Doctors at Konfanochi Teaching Hospital have expressed worry about the low level of knowledge of cervical cancer among the population. Specialist obstetrician and gynecologist Dr. Edu Apia-Kubi says the situation, which is worse, especially in rural areas, has led to late detection of the infection and treatment. He spoke at a cervical cancer screening at Oyoko in the Setre East District of the Ashanti region. Lava FM's Chrissy Deborah has more in the following report.
Medical officers were surprised to find residents had trooped to the event grounds at the break of dawn. Cervical cancer is an infection which causes cancer cells to form in the cervix. The World Health Organization says cervical cancer is the fourth most frequent of cancers in women. In Ghana, it's estimated about 3,052 new cervical cancer cases were recorded in 2012. It represents 32.7% of the total cancer cases among women in the country. Dr. Edu Apia-Kubi is an obstetrician and gynecologist at the Konfanochi Teaching Hospital.
The knowledge issue is very low. It's very, very low. Most of them don't even know what cervical cancer is. And it's very pathetic, considering the fact that cervical cancer is one of the cancers that we can prevent, and then we can cure it when we get it early.
In countries where screening programs are unavailable, diagnosis of cervical cancer at an early stage and access to effective treatment can significantly improve survival rates. Rachel Ajiman-Boateng is head of project committee of the Medical Students Association.
There are three ways that you can prevent cervical cancer, which is we have the primary, the secondary, and the tertiary preventions. And with the primary preventions, you can start by educating the public. So as a committee, that's what we've started doing. We are educating the public on the dangers of cervical cancer, the risk factors of cervical cancer. Promiscuity is a risk factor. Multiple births can be a risk factor. Multiple sexual partners is also a risk factor of cervical cancer. So we are trying to teach the public of the dangers, about the dangers of cervical cancer.
The foundation, which focuses on rural health, honors the legacy of late Dr. F.O. Ofusubakun, a renowned obstetrician and gynecologist. President of the foundation, Dr. Ben Blay Ofusubakun, advised women to prioritize their health and get screening regularly.
We can't keep doing it for them forever, but then to encourage them to periodically get screened for the disease and then treated if necessary.
The medical officers have taken samples for examination and report on the findings to the people. They also examine people for diabetes and blood pressure. Children were also screened and treated for various ailments. Beneficiaries received medication for free, and those with severe conditions referred for further treatment. Reporting for JoyNews, Chrissy Deborah.
You're watching News Desk. Coming up in business, the pound falls slightly as Brexit battle goes on. Daryl Powell has details.